There are many rewards associated with being a helper, and we encourage you to bring your enthusiasm and idealism to your work. At the same time, be aware of the potential stress involved in your work and how these stressors may affect you. The aim of this chapter is to share ideas for managing stress more effectively so you can prevent burnout and develop self-care practices that will keep you vital both personally and professionally. Too often, helpers in a training program are not given enough warning about the potential hazards of the helping professions. Becoming aware of sources of stress and learning strategies to cope with stress will enable you to maintain your optimism and belief in what you are doing in the service of others. Individual or personal sources of stress include the attitudes and characteristics of the helper, you. The sources of work-related stress for helping professionals fall into two categories: individual and environmental. To understand stress and the ways you contribute to your stress by your perception and interpretations of reality. Individual stressors can be discovered by examining your attitudes and personal characteristics as a helper. See the self-inventory on page 346. You may remember these theories from Chapter 7. As helpers, we can use our own theories to help ourselves deal with stress too. Self-monitoring is the first step to take to develop an effective stress management program. As helpers, we can complicate our life by believing that we must be all-knowing and perfect. If we feel depressed or agitated about the job we are doing, it is essential that we examine our basic assumptions and beliefs to determine how they are influencing what we are doing and how we are feeling. As we become more aware of our own faulty beliefs, we are in a position to change the patterns. By assuming the major share of responsibility for our clients, we relieve them of the responsibility to direct their own lives, and in addition, create stress for ourselves. See the definitions of these terms on page 349. They will be on the quiz. In addition to personal or internal sources of stress, external factors can create stress in helpers. Environmental sources of stress include the physical aspects of the work setting or the structure of the position itself. A major stressor is the reality of having too much to do in too little time. Other environmental stresses are organizational politics, restrictions imposed by insurance companies, unrealistic demands by the agency or institution, overly large caseloads, an overwhelming amount of paperwork, critical coworkers, cutbacks in programs, and lack of proper supervision. Another potential environmental stressor is the quality of your working relationship with colleagues. Dealing with coworkers and supervisors can be a source of either support or of stress. Environmental sources of stress are the umbrella of all types of external stressors and include organizational stressors. Organizational stressors are those specifically tied to the job placement that you have and the agency that you are working for. People in many different careers experience burnout, but those in the helping professions are especially vulnerable because of the nature of their involvement with people in need. Burnout is a state of physical, emotional, and mental exhaustion that results from constant or repeated emotional pressure associated with an intense long-term involvement with people. Burnout is characterized by feelings of helplessness and hopelessness and by negative view of self and negative attitudes towards work, life, and other people. Burnout is the result of severe, prolonged, and mismanaged stress. Those who work with people need to see that what they do is worthwhile. Yet the nature of their profession is such that they often do not see immediate or concrete results. This lack of reinforcement can have a debilitating effect as counselors begin to wonder whether anything they do makes a difference. When helpers find it increasingly difficult to be fully present for their clients and catch themselves responding in rehearsed and detached ways, burnout is not far away. If burnout is not addressed, it will likely lead to the helper becoming an impaired practitioner. Impaired professionals are unable to effectively cope with stressful events and to adequately carry out their professional duties. Many times when we hear the words impaired professional, we think about those helpers who have relapsed or begin to drink excessively. However, impairment may also include physical and mental conditions, such as physical exhaustion or depression. Professional burnout is an internal phenomenon that becomes obvious to others only in its advanced stages. Therefore, you should take special care to recognize your own limits. An important preventive measure to lessen the chance of burnout is to seek diversity in your personal life and in your professional work. By engaging in diverse personal and professional activities, you have a good chance of bringing vitality to your work. In addition, there are many things that the organization can do to help employees with preventing burnout, such as providing childcare at the job site, creating support groups, ensuring good clinical supervision is available, and offering counseling for staff members for a variety of concerns. Organizations that offer practitioners some degree of autonomy, self-direction, and independence will decrease and prevent the risk of organizational burnout. To retain your vitality as a person and as a professional, you must first realize that there are limits to your ability to give to others. In other words, you also need to take care of yourself prior to taking care of others. The analogy of putting on your own oxygen mask prior to putting on others' mask is very relevant. Rather than thinking in terms of avoiding burnout and impairment, because of course no one believes it will happen to them, it is better to think in terms of taking care of yourself and in striving for wellness. Self-care is not a luxury, but an ethical mandate. On page 363, there is a self-inventory of different suggestions for self-care and wellness. Wellness is a process of making choices that lead to a healthy lifestyle. This involves choosing a way of life that leads to zest, peace, vitality, and happiness. What is your personal strategy for self-care? A self-care program entails being attentive to the physical, emotional, mental, social, and spiritual dimensions of human functioning. For the discussion forum, review the self-survey on page 346 on individual sources of stress for helpers, and then also discuss your self-care program.